Hello, WHN attendees. My name is Alexander Riccio, and I'm a member of several groups that formed during the pandemic around the need to raise awareness of airborne transmission. I'm also the developer behind a crowdsourced CO2 tracking tool that's used by dozens of people in 8 countries to record and share indoor CO2 levels in public spaces. I had the idea to build it after months of helplessly watching our societal failure to adopt life-saving engineering controls during an airborne respiratory pandemic. I have no formal scientific or relevant academic background in this matter. I did not build this app as any part of a controlled study of any sort, and I've gotten zero government support or media attention. It's pure citizen science driven by my own outreach to find volunteers and some word of mouth. I sought scientific advice from a number of helpful experts in the Twitter groups where we communicate and over email. The biggest challenge so far has been the lack of widespread interest in airborne coronavirus precautions. Here in New York City, we have ended all mandatory mitigations, and the populace at large is under the impression that the pandemic is over. Without a wide base of popular interest, there is a much smaller pool of individuals who might be interested in the quality of the air in the spaces they visit. There is also little incentive for public spaces to measure or improve their own air. This makes it quite hard to reach critical mass necessary to be useful to the average citizen. So far, there are more than 500 measurements uploaded all across the world. More than 100 are from me. But you can see that there are volunteers in many countries, matter of fact, so many that it slows down the map, uploading their own data, usually from their own sensors. There's also been a concerted effort in Spain by a few very dedicated volunteers to upload lots of data. It looks like there are a few more in Belarus. You can see here in Spain, in different parts of Spain, there's been quite a bit of data uploaded. You can actually still zoom in and see individual locations. I haven't set it up just so that you can see the worst places yet, but there is still a lot of very useful data collected. The objective, of course, is to collect enough data for people to make informed decisions about the safety of the spaces they visit. By collecting data over time, we should be able to see trends as spaces change their behavior in response to developments in the pandemic or in the weather. My local coffee shop, for example, usually keeps their front door open. When it's very warm or very cold out, they shut the door, and that's when I've seen the highest readings. There, when it's very warm out, this June during a heat wave, and when it was very cold in March. Other locations, like this bar that I used to visit before the pandemic, sometimes have extraordinary levels of CO2, here indicating up to 20% of the air may be rebreathed. This was when it was extraordinarily crowded. In the longer term, I'd like to implement automatic live upload of measurements so operators of public spaces can provide the public with a real-time view of their air. In a perfect world, this would be built directly into a widely deployed app like Google Maps, but until they hire me, that's unlikely to happen. Lastly, a number of other groups around the world have developed systems similar to mine, but they're all intended for private consumption. For example, a group at a major Spanish university system is tracking measurements from dozens of sensors in a central database that's available to their administration on a private dashboard. Several companies now offer internet-connected CO2 monitors and similar web-based consoles for managing and internally viewing the data. They're mainly aimed at schools. I hope to see continued progress in this area, and I hope that we can all work together to improve our odds against this pandemic and the next one.